Over the past year, we've all likely had family members, friends, or coworkers diagnosed with breast cancer. And so, as you know, cancer can be a very difficult and overwhelming experience for those going through it and for their loved ones as well. When you have had a friend or family member diagnosed with breast cancer, you may have wondered how you could help. In this video, we're sharing 14 ways that you can support your friend during this challenging time. Whether you're able to provide practical assistance or just be there to listen, there are many ways that you can make a difference. So if you're looking for ways to support a friend with breast cancer, keep watching. We'll give you some concrete ideas on how you can make a positive impact on your friend's life during this difficult journey. Number 1. Don't ask for details, just listen. When a friend or loved one is diagnosed with breast cancer, it comes as a complete surprise. It's only normal to be curious about everything that's going on. However, they may find it challenging to respond to a number of the questions. It's possible that they don't have all of the answers just yet. Just take in what they're sharing with you. They are aware of the fact that you are at a loss for words. Try saying something like, "I can't imagine how you must feel. I'm here to listen if you want to chat." Number 2. Avoid saying things like, "Call me if you need me." It's quite unlikely that you'll ever hear from them. It is best to be as specific as possible about your capabilities. You may say something like, "I'm cooking some casseroles. Is there anything you would like or any ingredient I should avoid?" Or, "I can come by and do some cleaning on Tuesday or Thursday." If they have just had surgery, you should offer to wash their hair for them since it will be difficult for them to reach over their heads. Number 3. Their kids need support too. Children are children regardless of whether or not one of their parents is battling cancer. Make an offer to transport your friend's children to and from school and to their extracurricular activities, such as soccer practice. Contribute to making things feel as normal as you can. Because they are at a loss for words, many parents, teachers, and other adults avoid communicating with children who have a sick parent. Be someone they can rely on to help them. Let them know that you are willing to listen to them whenever they want to chat. Number 4. They need a ride-or-die sidekick. It is easy for a person who has been diagnosed with breast cancer to feel powerless in the face of the choices that must be made. They could require your assistance in order to make sense of everything. Make yourself available to attend essential doctor's visits with the patient so that you may take notes and ask questions. Having another pair of ears in the room with them could help them feel more at peace. You might also volunteer to transport them to their chemo or radiation treatments if you feel comfortable doing so. Number 5. The reconstruction process is not a boob job. A mastectomy, in which either one or both breasts are surgically removed, is a harrowing experience. It breaks the hearts of many women to lose such private portions of their bodies. Reconstruction may recreate the contours and appearance of their chest, but it is not the same as breast augmentation in this regard. It's possible that they'll need numerous operations until everything is resolved. Some women make the choice to not go through with it at all. Accept the decision that was made by someone you care about. Don't bother trying to sway their opinion. Number 6. Cancer does not care about age. If a person is in their 20s or 30s and has the condition, they have most likely grown weary of others asking them, "How can you have cancer when you're so young and active?" They may have a sense of loneliness as a result of the fact that many people in their situation are considerably older. When they are ready, encourage them to look for a support group for young people with breast cancer who can relate to what they are going through. Number 7. Men can get it too. Every year in the United States, more than 2,500 men are given the diagnosis of breast cancer. If the person is male, you shouldn't query why they have woman's cancer or argue that the diagnosis must be incorrect. Because they often feel alone and isolated, men who have breast cancer may need more support. First and foremost, you should urge the men in your life to have any breast lumps checked out by a medical professional as soon as possible. Number 8. Do not talk about prevention. Keep your thoughts and ideas on the prevention of cancer to yourself. It is not helpful to imply that your friend's breast cancer might have been avoided by anything, including yoga, juicing, diet, or anything else. Number 9. There is no standard treatment for cancer. There are various subtypes of the disease known as breast cancer. Some progress more quickly than others. Some patients need more intensive care than others. It's quite unlikely that you'll be able to determine with absolute certainty which kind your friend has. In fact, they may not even know yet themselves. Don't say things like, "So-and-so had breast cancer, and it was so dreadful," or, "My aunt's cancer wasn't a big deal at all." There is no such thing as a typical patient, and everyone reacts differently to therapy. Number 10. They sometimes have to just say, no. Patients undergoing therapy or recovering from surgery have a certain amount of energy and need to make the most of it in order to avoid exhaustion. They are sometimes forced to decline an invitation or abandon their previous engagements. They are not trying to avoid you. Their body needs a break for rest and healing. Postpone the event until they are more rested and take a rain check. Number 11. People need a break from cancer. The last thing your friend probably wants to do if they are interested in grabbing lunch or meeting for coffee with you is to speak about cancer. After all, people are not singularly defined by their illnesses. Make an effort to keep the discussion focused on common topics, such as their children, a recent trip, or a TV program that you both like watching. They will certainly bring up the subject of cancer if they choose to discuss it. Number 12. The treatment process takes a long time. A significant number of breast cancer patients have to continue taking medication for 5 to 10 years after their diagnosis in order to reduce their risk of the disease returning. Pain in the bones and joints, irritability, and weariness are all potential negative side effects of these medications. To counteract the negative effects of a medication, a physician may often prescribe an alternate medication, such as an antidepressant or a pain reliever. Be aware that the person you care about may not be able to return to their old self for some time. Number 13. Moving on is not always easy. The treatment is over, and there are no indications that the cancer has returned. That is really encouraging. However, it's possible that some individuals still have certain psychological wounds that need to be healed. Your friend or family member may be displaying symptoms of post-traumatic stress disorder, such as difficulty sleeping or outbursts of sobbing. They may incessantly check and recheck for any unusual lumps or bumps. Do not advise them to just try to get back to normal. Instead, encourage them to consult with their physician. Medications, talk therapy, and other treatments might be helpful. Number 14. Little things mean a lot. Even if you haven't spoken to someone with breast cancer in years, it is important for them to know that you are keeping them in your thoughts and prayers. Sending a thoughtful message or card to a friend in the mail is a great way to let them know you're thinking about them. Even if all you do is send them an occasional text message, it will make their day. It's possible that they are too exhausted to answer back immediately, but please know that your positive thoughts and well wishes are very much appreciated. We hope that these 14 ideas have given you some inspiration on how you can support your friend with breast cancer. Remember, each and every act of kindness can make a big difference in your friend's life. So don't be afraid to reach out and offer your support. They may need it more than you know. If you have any other suggestions on how to support a friend with breast cancer, please share them in the comments below. And if you know someone who could benefit from this information, make sure to share this video with them. Together, we can help make a positive difference in the lives of those affected by breast cancer. Be sure to give this video a thumbs up. Please subscribe and click on the bell icon so you won't miss any new videos from Red Button Journal. Thanks for joining us.